Welcome to another GCA Academy. Good afternoon, good morning for some of you. My name is Marta Soldavila, and I'm the GCA Academy Director at GC Aesthetics. Our topic of today is mini-invasive breast augmentation. And joining us today, we have Dr. Benoit Ayesterai from France. And we are so pleased to have him that he's going to share his experience on this technique, on this approach. I want to share with you some insights, some part of the key topics on his curriculum. Dr. Benoit Ayesterai is a surgeon specializing in aesthetic surgery, plastic surgery, reconstructive surgery, and aesthetic medicine in Paris. During his medical studies, his vocation started when he discovered breast reconstruction possibilities, and he's mainly interested in reconstructive microsurgery and made his medical thesis on perforated flaps. After working at the French hospitals, he improved his skills thanks to world-renowned specialists in Brazil, in Sao Paulo, and Japan in Tokyo. He has several publications in peer-reviewed journals and books on the field. He uses the newest and less invasive procedures that leads to minimum post-operative care and short recovery. Just as a disclaimer, just for you to know that, of course, Dr. Ayesterai is going to share his own experience, his own opinions. Feel free, if you feel like you want to ask any question, feel free to do that. You can use the Q&A, the questions and answers section, or the chat below. And just as a kind reminder, remember that if you want to check lately the recording of this session, please feel free to join the GC Academy webpage, this gcacademy.com webpage, where you will be able to see not only this recording, but also you will be able to see other expert talks and live surgeries. So without further ado, I would like to give a big thank you to Dr. Ayesterai for joining us today. It will be an honor to have you today. And I just will now hand over to the doctor so he can share his presentation. Thank you so much, merci beaucoup, for your talk, for joining GC Academy and sharing your know-how on this topic. Thank you so much.
Oh, thank you, Marta. Thank you so much to inviting me for this GC Academy. It's a pleasure, and I'm really honored to do that. I wish you can see the presentation now.
Yes, we can see it.
Okay, so I just want to introduce, the mini-invasive breast augmentation concept. So this is the technique I use in plastic surgery to make breast augmentation. So I wish you will like it. So I will just introduce breast augmentation procedure, the breast anatomy, different breast augmentation techniques that can be used, the breast implants, which implants you must use, the traditional way to make breast augmentation, Then we'll talk about hydrocomb and impleo smooth implants. Then I will share with you the mini-invasive breast augmentation technique. So first, the breast augmentation now is very, very popular in plastic surgery. In a study in 2018, so there were almost 2 billion breast augmentations all over the world. Most of them were made in the US. The other were made in Brazil and in South America. Then it was made in European countries. So it's a very, very popular procedure in plastic surgery. Which is important to know is the breast anatomy. Breast is a very unique in a woman's body. It will make woman's body beauty thanks to a curved shape, a well-proportioned shape. So it's very important. But it's also very unique because of the lactation. So inside the breast, you can see some mammary glands and mammary ducts. It's very important not to damage them. So after lactation, the women can breastfeed their child. So this is breast anatomy we must respect. For the breast augmentation techniques, we can divide in non-permanent and permanent techniques. So non-permanent breast augmentation, we can have some fillers. So fillers is not very popular, but in some countries you can do it. It's not so popular because it's resorbable. So after 1 year, you must do again. So permanent breast augmentation techniques are more popular. So the first one is lipofilling. So lipofilling is just a fat transfer to the breast. It's very interesting, but the volume is very small. So usually we use breast implants to perform breast augmentation. And in some cases, we can combine breast implants and lipofilling. So for the breast implants, we have different types. We can use some saline and some silicone implants. So now we cannot use in France saline. So silicone are more popular. We can use a round or teardrop shape. In cosmetic surgery, we use round shape in general. We use smooth surface or texture surface. In France now, texture and polyurethane are forbidden. So we only use a smooth surface, but it's very good. It's very good implant. And there's different profile. You can choose low, moderate, or high profile according to the size that the patient wants. For traditional breast augmentation, we can use different kind of incision. So there's different way to make breast augmentation. So there's advantage and inconvenience with each way. So the first one is inframammary way. With this breast augmentation technique, there will be no scar visible on the breast. The scar can be very short, much more shorter than the areolar length. There is no mammary gland damage, okay, and we can easily perform some dual plane procedure. The second one in the peri-areolar way. So in this way, you will have a scar visible on the breast. The scar length will depend on the areolar length. So sometimes it's not so short. And the most inconvenience if you have to do some mammary gland damage to make the pocket for the implant. You can perform some dual plane technique with a peri-areolar way. The third one is the transaxillary. So transaxillary, there's no scar visible on the breast, but in the axilla, usually the scar can be very long and very visible. With this way, there's no mammary gland damage, but you cannot perform a dual plane procedure. And the last one is the transumbilical. The transumbilical is not popular, it was just experimental and not very used. So comparing all this way to perform breast augmentation, for me, according to me, the best is the inframammary way. So in the traditional way, for inframammary breast augmentation, you can see these pictures on articles. Most of surgeons, they are using a 4 to 5 centimeter scar. So this is an article in the Aesthetic Plastic Surgery Journal in 2014. So you can easily check that the length of the scar is very, very long. So 4 to 5 centimeters, sometimes 5 to 6 centimeters. So there's no scar on the breast, but usually the patient will complain about the scar length in the inflammatory fold. So how we can improve the satisfaction of the patient, how we can improve the cosmetic result, just minimizing the scar length in the inflammatory breast augmentation. So how to do it? First, we must use some new device. So we must use hydrocone. So hydrocone is an implant insertion device. It's sterile, it's a single use, and it's very convenient to facilitate the insertion of the implants. It's also very good for no-touch technique. So hydrocone can allow not to touch the skin during the insertion of the implant, so there will be no bacterial contamination on the implants, the surface of the implants. So this is the different steps of hydrocone. So if you think you can reduce the length when you cut the hydrocone. So the first step is you hydrate, second step is you load, and after you trim. And when you trim, you can reduce considerably the length of the hydrocone, and so you can be able to reduce the length of the scar. So here is a video using hydrocone. So you can see that the implant is just sliding into the hydrocone, and you can insert it through a very, very small scar. So now, which implant will you use? So according to me, you must use round implants in cosmetic surgery, smooth implants with smooth surface, and with a very soft gel. So the best implant for me are Impleo implants, which is commercialized by GCA Aesthetics. So what is interesting? So it's a smooth surface, so the result will be very natural. Okay, it's not like texture implants. So the texture implant before, when you could use it, was very high. Now with a smooth implant, you have natural results, and there's no texture associated risk. So there's no risk of lymphoma. There's no risk of capsular contracture like texture implants. And then the second interest is the cohesivity. You can see on the graph is a softest gel than we can have today, and it is the most cohesive gel. So it means that the softness is very high, but the shape will always remain the same because of the cohesivity of the implants. So according to me, the best implant to use now is Impleo implants, smooth implants. So we can see the same on this graph. You can see the shell, the smooth surface, and the soft gel inside. Now I will introduce a mini-invasive breast augmentation. So this concept is a 1.5 centimeters inflammatory scar. So you can, instead of doing 4 to 5 centimeters, you only perform the breast augmentation with 1.5 centimeters. In France, in general, in Brazil too, and in Dubai also, women want to have a larger volume, a big size. Okay, so we use, in general, more than 300 cc. So for more than 300 cc, so I perform 1.5 centimeters. But when some patients want very low volume, very small size, so we can perform 1 centimeters to 1.5 centimeters using less than 300 cc implants. And with this technique, to make it possible, so we must use smooth surface and soft cohesive gel.